In some cases of CRPS, it is necessary to utilize more than just ketamine infusions in the treatment plan. It is extremely common for people, particularly athletes, to develop specific trigger point pain in their muscles as a result of chronic CRPS. Trigger point injections can be an essential addition for many of these patients and can result in dramatic improvements. This video highlights the importance of proper technique in treating trigger point pain in the overall management of CRPS.
We did your pain thresholds, and now here's the deal with you. The deal is that your pain threshold started high already, so there's nothing to really significantly improve on. So we have to rely, in your case, a lot on function, okay? So what we're going to do now is run through the functional things. Just to be clear, we're going to go through the usual stuff. So I want you to sit up straight, please. Vertical finger test in your mouth. Two vertical fingers. Are you having any pain when you do that? Good. You didn't have any to start with, and you don't have any now. Now, you did have some issues in getting your arm up. So let's see it on the right side first. Get it up as if you're going to comb the back of your hair. Yeah. So you still have issues there, right?
Yes.
And we're going to talk about that more. As a matter of fact, I'm going to go back over here, and there is a trigger point. I'm going to point out over here, right there, where I'm pointing my finger. There's a little mark there, so we can get it on the tape. Right there, you have a trigger point. And we've been talking about the pros and cons of going ahead and doing a local injection there, and we talked about that with you folks that have CRPS, you have to be really careful because any needle you get in your skin is in a sense trauma. So we have to use a very fine needle, and we have to do very slow injection on you to minimize trauma to your tissue, okay? And we also talked about that will help us because the next thing I'm going to ask, okay, go ahead and put your left hand behind your head. See if you have problems there. Are you okay there?
Mm-hmm.
Okay. Now, the other thing, put your arm up like you demonstrate how you're limited, how far you can rotate it down. Yeah, right there. That's fine. Okay. And we think that's what's causing it over there. Now, on the other side, do the same thing. Show us that you're okay over there. Put it down. No problem, right? Okay, excellent. Take the right hand, put it out in front of you. Open and close your hand as fast as you can. There you go. And, of course, that's causing pain up in your shoulder, isn't it? Yeah. Okay, good. Do the other side, please. And that doesn't cause you any pain, right?
No.
Okay, excellent. We're going to go ahead and do that trigger point injection. We're going to have you come back. I'm going to see if we can improve on that range of motion on that right upper extremity, okay? And you are right-handed, aren't you? Or are you left-handed? I can't remember.
I write with my left hand, but I do everything else with my right hand.
Right.
Like
well,
open doors. And
well, yeah, so your right hand is an important part.
Yeah.
Okay, okay, very good. I'm going to numb the skin down so it'll make it easier on her.
Okay.
And so, what I'm going to do is just kind of walk through this, talk through it. Basically, the first thing we're going to do here, and I'm going to tell you what I'm doing, okay? First thing we're just going to numb down the skin with a little TB syringe. This is the worst part of the whole deal. I told you it would be. And now this is going to have a little bite to it, but it's going to make it so much easier for you going forward, okay? To get this really kind of numb right here. Everything else is a piece of cake. That's the hardest part of the. You just got the worst part of the whole deal. The thing we want to do here is we're using a 25 gauge needle, and the reason we're doing that is because we don't want to cause any trauma to the skin that's absolutely necessary, or the muscle. So we're going to get through the muscle, through the skin right now. And the other part of the story is you start out really, really slow with the injection. I mean very, very slow, because if you go too fast, it's very painful to the patient. Okay, and that's it. Okay. If you look here, you can see how small. Look how slow I'm moving this thing. You see that? It's moving very, very, very slow. Okay. Okay, Leslie, we just did your local injection. They call it a trigger point injection, and we documented on video how it should be done. If it's not done right or properly, you can actually make patients like you worse, okay? So first thing I want you to do is, for comparison, I want you to have no problems with your left hand. Put that behind your head like you're going to comb your hair. You can do that? No pain?
Nope.
Now see if you can put that other hand behind you without any pain.
Yeah.
Any pain?
Nope.
So that tells you that what was causing it is that trigger point back there, right? Mm-hmm. The other thing is, do it on the better side over here. Rotate your arm down. Okay, good. Now see if you can do a little better job on it over here. That's much better than you could before.
Yeah.
Yeah. So by doing this therapeutic intervention to make you feel better, it not only provided us with treatment to help you, but it provided diagnostic information. Okay? And so we know now why you were having those problems. Insofar as what's going on down there with your foot, why you can't abduct better on that right foot there. We'll have to just see how it goes. But the bottom line is you're walking a lot better than you did before we treated you this time. A lot better.
Yeah.
In fact, you're almost like a ballerina. Okay? Very good. Any questions?
Nope.
Okay, very good. Okay, Leslie, today is January 23rd. It's been about, let's see, about 6 weeks roughly since your, it was a second session of a ketamine infusion. And you did benefit from that overall, as you did from the first infusion we did. And again, that was a 4-day, was it a 4 or 3-day?
It was a 4-day.
4-dayer, right. However, we did identify some limiting problems in that right shoulder of yours in terms of mobility. And we went back there and examined you, and there was a trigger point back there. And what happened in the meantime, well, first of all, the trigger point injection we did on you, which illustrated that you needed more than just ketamine, actually gave you improvement for maybe 3 to 4 weeks. However, in the meantime, you went and had some what they call independent medical evaluations done, which aggravated your pain, and a trial of spinal cord stimulation, which aggravated your pain and probably set off that trigger point again. So we're back here for another trigger point injection, which is a relatively simple procedure, but must be done appropriately. Am I accurate? Have I pretty well stated about with regards to the trigger point? We're going to talk about some. Well, in the meantime, you had an episode of some symptoms in the side of your face over here on the right side, some numbness, and you had some sagging, some twitching in your eye over here, and which looks more like a temporary Bell's palsy, which tends to come and go. However, just to be on the cautious side, they want to make sure you didn't have a stroke, so they did some imaging, did a CT on you, there was nothing there, and there's a possibility you may have an MRI done to further assure ourselves that there isn't anything going on between your ears. Okay?
Okay.
So, did I pretty much capsulize accurately what happened here?
Yes.
Okay, very good. So now let's go through our physical examination. Okay, Leslie, here we go. You know the drill pretty much. Okay, look straight ahead. Take that left hand, put 2 vertical fingers in your mouth. Having any pain in your face when you do that?
Mm-mm.
Okay, very good. Next, I want you to take that left hand, put it behind your head, and tell me if you're having any pain when you do that.
No.
So you didn't have any pain, your mouth causing pain and your left hand going behind your head never did cause you any problems. Now we're going to go over to the right side. That's where the issues are. So let's see if you can see how far you can go without torturing yourself. Get that right hand behind your head like you're going to comb your hair. Right about there?
Yeah.
Okay, very good. Excellent. Now the next thing I need to ask you, when you did that, and if you need to take your hand back there to do it, tell me where you had the pain when you did that. Where did you feel it?
All in my shoulder joint.
Did it ever get down into your elbow and into your hand when you brought it up there? Or is it pretty well isolated to your shoulder?
Isolated. I can feel it
But
in
it's,
my arm.
but
my
it's
elbow,
so very intense in the shoulder area.
Yeah.
Right.
The shoulder's killing
And
me.
you know, if we don't get that pain down, there's a risk of getting a frozen shoulder, which is a very bad news thing. And for someone like you, it's really bad because, you know, you're a very athletic person. You came from a very athletic background, okay? Mm-hmm. And by the way, while we're on that subject, it's not uncommon for men who are very athletic, particularly bodybuilders and that sort of thing, to develop these trigger points, these myofascial trigger points, okay? So we always got to keep our ears open for that. Okay, next, I want you to take that left hand out in front of you, open and close your hand as quick as you can. Bring it out in front of you like that, girl. That's it, very good. Use your thumb now when you do that. There you go. Now see how good you can do with that side. That's it. Really hurts, huh?
Yeah.
And where does it hurt when you're doing that?
All in my shoulder.
Particularly the shoulder?
Yes.
Okay, very good. Excellent. Good job. So the other problem we have with you, of course, is that rotation at your shoulder. So take the left side up, bring it down. Okay, good. No problems with that, right?
No.
Now go over to the right side and see how far you can get without torturing yourself. Right about there? That's it? Yeah, okay. So we're going to test that when we get done today, okay?
Okay.
Okay, Leslie, we just finished your trigger point injections, okay? And I think we still have the mark back there where we did it. And let's take a look. Yep, there it is right there. That same spot. We got it. We got it again this time right there. Okay?
Okay.
All right. Now, what we're going to do is put you through those exercises and see the improvements, if any. Okay, you ready? All right, first of all, vertical finger test, look straight ahead. Yeah. Any pain when you do that? You didn't have any pain when you started, you don't have any now. Go ahead and make sure Dr. Kirkpatrick didn't create any new problems. Take that left hand, put it behind your head, please. Any pain when you do that?
No.
Didn't have them when we started, you don't have any now. Okay, take it down. Now do the other one, see if you get it back there. Say you can get it back there, you're not having any problems, right?
Right.
All right, so the next thing we're going to do is take the left side. Remember how we do this kind of thing?
Yep.
Okay,
Oh.
do that side first, bring it down. Okay, good, good. Now do the other side, see if you can do that without killing yourself. You can do it
Yeah.
now. Okay, good. And let's see, the last thing we want to do on you is that once you take your left hand out in front of you, please, and open and close your hand as fast as you can. Good, good, good. Use your thumb too. Atta girl. Good, good. Now do the other side. Okay, good, good. All right, so what this all proves is that sometimes in treating patients that have complex regional pain syndrome, or if you prefer RSD, you have to do more than just ketamine on them, because it's not uncommon for these muscle problems to develop, especially someone like you that comes from a very athletic background, okay, to develop these trigger points. And so they're treated differently, you see. And that's what we did here. And it's really important to do that, because then you can do what's really important, that is the heated pool exercises, okay? You can't really get in the water when you got a bum shoulder. Furthermore, if you don't treat the shoulder, you can get what's called a frozen shoulder, which is very, very bad. Now I expect from this, this trigger point injection that we did today, that should last you for months, okay?
Okay.
What you got to do, be really careful, no passive manipulations of your shoulder. Don't let anybody go yanking on your shoulder again, okay?
Okay.
No doctors, just tell them no, it's forbidden. Dr. Kirkpatrick will give you a hard time if you start messing with my shoulder, okay?
Okay.
And also, you got to be careful you don't re-injure yourself there, but I expect you to do well, okay?
Okay.
Do you have any questions for me?
Nope.
Okay, good.